I will begin by reading out Winnie Byanyima's brief profile. Winnie Byanyima was appointed as the Executive Director of UNAIDS by the United Nations Secretary General on 14 August 2019. Ms. Byanyima has been the Executive Director of Oxfam International since 2013. Prior to that, she served for 7 years as the Director of Gender and Development at the United Nations Development Program. Ms. Byanyima began her career as a champion of marginalized communities and women 30 years ago as a member of parliament in the National Assembly of Uganda. In 2004, she became the Director of Women and Development at the African Union Commission, working on the Protocol on Women's Rights, on the rights of women in Africa, an international human rights instrument that became an important tool for reducing the disproportionate effect of HIV/AIDS on the lives of women in Africa. She holds an advanced degree in mechanical engineering, into brackets in energy conservation and the environment from the Cranfield Institute of Technology, and an undergraduate degree in aeronautical engineering from the University.
This virus found a very unequal world, and like every epidemic, it just makes those inequalities worse. It worsens inequalities, it feeds on them. And in Africa, this has found us very weak. Like you've said, with already a high burden of HIV, collapsing health systems, and economies that were already slowing and mounting debt. So economically weak, vulnerable health-wise. I mean, a country like Zambia has between 2015 and 2018, in 3 years, its debt repayments went up by 760%, and it cut its health investment by 30%. That's the direction many of our countries have been taking. So we've been found weak, health-wise, weak economically. But it's challenging in the richest countries. I mean, we saw how a country like Italy was so challenged, is still challenged. This is a country with one doctor for every 240 people. Now you compare again with Zambia with one doctor per 10,000 people. So, and some of it you must laugh, but it's not funny. My friend Patrick Gaspar, who heads the Open Society Foundation, reminded us recently that South Sudan, a country of 11 million people, has more vice presidents than ventilators. 5 vice presidents, 4 ventilators. That's how bad it is. But it's also sad when you see people like in India now being turned away because hospitals are overwhelmed. So this pandemic has stretched our health systems, destroyed our economies, made countries that are already burdened economically face a tougher situation. You've mentioned also how if we don't take care of other diseases, we will find ourselves really in a vicious cycle to the bottom. UNICEF has said that 80 million children under 1 are at risk of these diseases like measles and polio because of COVID disruptions and so on. So, but beyond that, we have to scratch deep and see that it's not just a health crisis or economic crisis, it's a rights crisis, because it is those who don't have rights that are hit first and who don't have help. So coming to Africa, I cannot but praise Africa CDC, the Center for Disease Control, and its leader, John Nkengasong. This guy is incredible. He's a gift to Africa, and an African we should be proud of. When this COVID hit in February, Africa had just two labs where you could test for the virus. In 1 month, he had moved that to 43 labs, almost one in every country. That is a kind of quick action, strong leadership that we need in Africa. But as I said, he said to me recently, he said, I am launching what he calls the Partnership to Accelerate COVID Testing in Africa, PACT, because he says, unless we can have the political leadership and the means to test, some of these results of low cases, we shouldn't trust. They may not be reflecting serious testing. So he said, let's do this aggressively. But you know what he told me? He said, Africa is in the back of the queue to buy test kits. Even with our money, even pulling together as Africans to buy in bulk together, we stand at the back of the queue as rich countries stockpile for themselves and leave us to be without. So he said, help us to amplify our voice that we must have equal access to PPE, to test kits, and to a vaccine should it come. But he's ambitiously pushing for testing, and we are beginning to see some countries that are stepping up politically and in terms of putting the tests on the ground. So what we need to do, you said, we need to quickly step up strengthening our health systems. That means investing. That means that the international community must look at this situation of debt and respond better. This relief of 6 months is meaningless. 6 months? This thing is just coming to Africa. Within 6 months, that's when we will need even more money in our systems. So to relieve African countries of debt for at least 2 years, to look at cancellation where possible, and also to look at in future debt sustainability strategies for that. That's one. Then our countries themselves to reprioritize, to put more in health than in vice presidents, for example, the reprioritization that we need to make. And then to aggressively go for progressive taxation. There's money to collect that's not. I'll give you an example of Kenya. Kenya, we estimated some years ago that it was losing $1.1 billion in tax exemptions. That's just a few companies negotiating themselves out of the tax bracket. 1.1 billion is twice the health budget of Kenya. So just cancel those exemptions. So some more progressive taxations, putting the burden on the companies that extract in our countries, will bring us some more resources for the health system. Go away from these user fees. User fees are in more than 43 countries of Africa. How can someone go to test if they are going to be asked to put money down? So we cannot fight an epidemic when we are profit-led. We've got to fight an epidemic by rolling out vaccines, treatments for free. It's not rocket science. It's simple, plain common sense. So we need to invest public money in health systems and reprioritize and go for more progressive taxation that shifts the burden. To me, those are some of the things that we need to do, and the international community to support, knowing that you're not supporting because you are helping Africa. This is a global crisis. No one is safe without all of us being safe. Let me leave it there, Charles. Charles, are you not on mute?
Yes, sorry. Within Africa itself, we have pockets. If you see, for example, the impact, we are seeing data that the impact on the informal sector has just been terrible. Yeah. We are looking at a scenario of possibly 30 more million people getting into poverty. First, where do you think there are quick economic interventions that can be done for these kind of groups? And if you think of policy, even when you talk of inequality, inequality is really not the start. It's not the cause. It's a result of other structural things that grow into inequality, and you have touched on that a little bit. Where else? Where are the low-hanging fruits? Where you think something can be done? You just make sure that this particularly, people in the informal economy, the mothers and the children, probably don't fall as far down as they could without those kind of quick interventions.
Okay, Charles, first of all, we need to be humble to accept that we got it wrong by going out to fight a health crisis with a public health approach and not recognizing that those public health measures themselves have socioeconomic impacts. And therefore, you must go out there with a multi-sector approach from day one, knowing that if my measures mean that people will stay at home, then that means that their businesses will close. Their employers will not be able to, things will not, to know all that and come out in advance with a multi-sector approach, we didn't do. We first came out with a health approach, then we said, oh, by the way, people are going to starve if they stay at home. By the way, if they are migrant workers, if we close borders, how will they get back to their villages? People walked in India and died walking hundreds of miles from migrant workers, from where they were working to find a way back to their countries. All these things we need to recognize that we didn't come out smart, and in future we must be smarter. We talk about this in HIV because we learned over 25 years, but we were not able to influence the whole world. That's one. So when you talk about these socioeconomic impacts, Charles, it's not even those groups as we call them. It is nearly everybody in our poor countries. Africa alone, our informal sector workers are 86% of the entire workforce. So it's a majority, they are informal. When it comes to women, this is where it's gendered, 90% of women are employed in the informal sector. So you're talking about the majority are being people who are daily earners. They don't even earn after a month. They work and they get paid. They eat at work. You're talking of people who have no social protections whatsoever. It's that cash in their hand and nothing else. So rolling out social protection for them should have been not an afterthought. And when it came, it should have been stronger than it is. Look at what we are seeing, the positive stories. Some countries immediately said, you don't have to pay your water bill, your electricity bill. They give support in utility services, others with food. But the data is telling us that millions are on the verge of starvation, partly because of the other crises that are already in the world, wars, droughts, locusts, but also because of the measures. They have compounded it. So social protection is important. Targeting it carefully to the people who most need it is important. And I'm afraid some countries have done right, many others haven't. I think in Kenya, their cash program, injecting cash, has been a success because it kickstarts local economies and gives people choice on what to spend on in their families. Some of the food projects have worked, but again, rights, human rights. When you see many countries, our own data tells us that the people most in need are the ones who don't get the social protection because rights are not being put there as important. Take sex workers. Sex workers are women like anybody else. But in many countries, they are being labeled as the cause of the problem. They are being hounded out of their accommodation. They are not given the supplements for being unemployed. Some of them are not employed because of COVID. then it means that they can't go and say, I don't have a job, can I also get some supplement? I mean, you see that transgender people are told, bring your identity before you get food, but it's what I don't have. An identity is what the government has denied me in the first place. So rights are important. Minorities suffer because they are already oppressed as minorities. When it comes to social protection, the same deprivations are patterned in the social protection. So rights are key. But here are some good examples. Africa has fought epidemics before, and that has also brought us some strengths that probably even the richest countries don't have. We know how to move our communities quickly, how to get them to act to prevent disease for themselves. We've been through cholera, Ebola, but we've learned something. And those countries that have built on what is already known are doing better, like South Africa. They're doing well because they're building on what they've learned through several rounds of fighting epidemics. You could even cite more countries, even Uganda, my country. Uganda has done fairly well on the prevention side because of having networks, local communities empowered and able to transmit messages quickly of prevention and do control. So yeah, Charles, we have good stories to tell.
Yeah, Winnie, it's interesting, you touch on some of those models that work, and I think we need to go in to open it up for questions shortly. But it raises two questions. One is again the structural thing, because if you look at this intervention, giving food, giving waivers on electricity and utility bills, those are really they are episodal. They are not programmatic.
Mm.
If you look structurally, at just macro level, if Mauritius with its social welfare, do you actually see countries that have sets of structures and practices in place that you think have stood them in good place? And then also, if at the tail end of that, you can touch on this thing that we have seen, the violence, for example, the gender violence is really shocking. It has really become shocking. I mean, in Nigeria, all the 36 governors had to sign a joint declaration of a state of emergency. I mean, in South Africa, I think Cyril Ramaphosa is talking of declaring an emergency. Where does this come from? What is it that has broken these countries? As soon as they get to this kind of pressure, we see this very brutal and savage attack on groups of society, people in society.
Now, Charles, you are going to get me excited here.
No, you only have a few minutes.
Okay, all right, I'll be brief. First, we've been with this neoliberal agenda for so long, 40 years and more, and they've persuaded everybody that we don't need government, that the private sector can do everything. And we've slowly absorbed it. But now, Corona hits the whole world, and even the most conservative governments people are saying, we need government, we need the government. So government is back and investing in public health, public education as a leveler, as a way to keep society together and everybody moving is back. So this whole experimentation with the health systems that are built on profit motive, and they're just a lot of rubbish, to be honest. We need to have strong public provision, government provided healthcare for all, and that is and social protection for those who are not responding to markets, who for some reason cannot get a paid job. They too must, they have retired, they are old. We need social protection. So we need to campaign more, and that's why I'm very involved in campaigning, and I'm leading a campaign on the people's vaccine, saying if there's a vaccine, we cannot afford to be where we were with HIV, where those from rich countries were being treated and living, and here in Africa we waited 10 years and our people died waiting for the price to come down. No, we want a vaccine that's a global public good, that's free for all. So going back to health systems that are modeled on public provision, yeah, with some elements of private for those who can afford. 2, a health system that is built on human rights and the role of communities being important in prevention and disaster and disease preparedness, epidemic preparedness. So those are, and we can see from countries like Thailand, countries like Korea, and you can see it in rich countries which had welfare states that are doing better than those who had health system based on private sector. So that's 1. 2, we need to go back also to global solidarity. The idea of global solidarity, it is not just about helping the poor. It's about certain global public goods. So I have already mentioned that. And then you talked about gender equality as a major inequality in society that is undermining so many other goals. Look at this, isn't it shameful that COVID, which led to lockdowns and people going back in their homes to protect themselves, that women don't find safety at their homes, that gender-based violence peaks because girls and women have returned home and men are coming to stay at home when they used to be out there. I mean, something is shameful there. So tackling what UN Women calls the epidemic of gender-based violence is critical. And it is time we put real resources there. And didn't COVID also expose other inequalities like racial inequality? Isn't it now the time when we must tackle systemic racism in all our systems, ethnic divisions, this whole putting people in a hierarchy according to their identity, breaking down that. So I think COVID is waking us up to re-examine and assess our systems and pull out all biases so that they work for all. Okay,
Thank you,
I am
Winnie.
excited.
Alex, I think the people have been bombarding Winnie with questions.
Okay, I'll go in the chat.
Okay, so yeah, it's true. Everybody's asking interesting questions of Winnie. So if I might start, Winnie, you made a very good point when you said that COVID is capitalizing on pre-existing conditions, whether this is in the body of the human or in the organization of government and societies. You talked about weak health, existing disease burden, debt, weak institutions, poor governance. So one of the participants is asking whether you see a correlation with respect to the intensity of the pandemic in different African countries that can be explained by pre-existing weaknesses in structures of government, competence in the leadership, for instance, and feel free to draw on some examples as best as you can.
Oh my God, that is so true. You see, if you are going to make success in fighting an epidemic, what we have learned from fighting HIV is that you have to be evidence-based. Evidence-based means you have the evidence on the epidemiology to know your epidemic, how is it moving and how is it penetrating, and so to know how to prevent. But two, as I've said, an epidemic is not just a health issue. It hits out through all inequalities and becomes an economic and social issue. You need your social scientists on the table. to bring the evidence from social science. You need the evidence from economists who will tell you how the economy is going to be affected, is being affected. So unless you have a team, you need communities to tell you how to change behavior and get communities to change. So to do that, you need a governance, a response that is based on inputs from so many. But if you are Mr. Know-it-all and you think that because you won in the past through security measures, so the response will be security driven, you're not going to get anywhere. Or if you think you are a successful businessman and you have made billions and therefore the response has to depend on your knowledge of making billions, then God help the people in your country. So we need governance. We need to be able to pull teams together of people who bring knowledge from different disciplines. And then you make a response, and then you have the discipline to enforce what has been decided. So countries that don't have a practice of using the expertise of local knowledge and expertise of those who have read the books, who are not inclusive, are far behind. And if you want me to cite examples, I can cite where you are in Kenya, that you are a good example. You do try to work with evidence, even though you also have your weaknesses, but you try, your response is built upon the knowledge of people from different streams of knowledge. An even better example, I could say, South Africa, which has a scientific committee that is debating and arguing loudly with the government on the science, and it has communities and NGOs driving from somewhere, also pushing the government in different directions. And so you have many voices shaping their response. So governance is key.
So a quick follow-up. In your opening remarks, you talked about Africa needing, or the world needing, smart actions to combat COVID-19. But in kind of an ordinary conversation, smart implicates technology, it implicates young people. What, in your opinion, would be the role of technology and youth in supporting the fight to tame this pandemic?
Well, young people are very important in leading responses on the ground. I think that we underestimate their, young people change easily. Young people will quickly embrace a new way of doing things. So when we talk about communities leading prevention, leading fighting epidemics, I see it as an important place for young people to be. They use their art, they use their tools of social media and whatever to drive change for prevention, change for treatment, and so on. So I see an important role of community leadership for young people. I see technology as key. Look, now people locked in their homes and businesses not working, schools not working. How do you mobilize for prevention? We really have a tool through social media, through internet, to be able to speak to everybody. And people use digital. Almost every home now has a smartphone. So there's opportunity to use technology for prevention. And I think some countries have done well using it better than others.
Okay, thank you.
Obo, you have some more questions?
Yes. If I would want to move Winnie to kind of look to the future now. We have a lot of talk about what a post-COVID world looks like. And a lot of it is superficial. We'll have an empty seat in the plane and all of those, but those are better. But if you think of the bigger things, How do you actually see our societies changing? And the reason why that is important is that we really then need to prepare for that. What is your reading? What do the trends and the data tell you? And particularly from an African point of view, where do you think the adoptions will have to come very quickly? Like by the end of this year, we will be confronting those changes.
Well, some things worry me and some things excite me about how I see the world changing. In the immediate term, I'm worried about those parts of, and I'm talking as an African and the African context, I'm worried about those parts of government, of public service that depend a lot on aid budgets. We're going to see a shrinking of aid budgets inevitably because of what's happened in the rich countries. They are going to take years more than, look, what has happened in terms of the loss of employment, the injection of money to stimulate their economies is unprecedented. It's never even happened with the Great Depression, the kind of impact that has happened in the economies. So they are going to take long to recover. We're going to see a shrinking of aid budgets. So if our health systems, for example, HIV response, do you know, Charles, that in more than half, maybe almost all the sub-Saharan African countries except South Africa, the HIV response is funded 90% and more by aid budgets? And you're talking of millions of people who need their pill every day. Okay, so those parts that depend on aid, I'm worried about what's going to happen unless governments do serious, we can afford it, but it requires serious reprioritization, cuts in other parts in order to save lives. So that's an immediate fear I have also a positive sense that the world has learned that the health system is more than curing some diseases. It's about preparing and being ready for epidemics like this and preventing disease. So building this part around it, and if I can use an example of a visit I made to Eastleigh, one of the slums of Kenya, and I found a woman there called Jacqueline, who is a community volunteer. But literally, she carries the shoulder of her whole slum area, getting people out to go to get treated and tested and treated for HIV. Earns $20 a month. Wow. So we have a whole network of community voluntarism that supports the health system, but that is not included. It is time to restructure and make health more a system that uses and rewards communities for their contribution. So reforming the health system is something that I'm finding exciting because it takes us to tackling those structural inequalities you mentioned. So that's for me a positive, that health and the way we tackled health in the past is going to change as a result of COVID and in some positive ways. But globally, also what is exciting me is that really we have been forced, this virus has forced us to work differently and in a more environmentally sustainable way. I've not stepped on a plane for 3 months. It had never happened. And I've done all my major meetings. Few canceled, but most happened. So there is no reason on earth why we should go back to working our economies while roasting our planet. We can reduce this. We can move more ambitiously towards reducing global warming. So that's a positive. For us as Africa, again, I see something that we need to learn. Charles, do you know that we have, I think we use about 6 billion. We need about 6 billion condoms. Okay? That's how active we are as Africans. Of this, we only have about 3 billion are available. So there's an unmet need. But out of the 3 billion, 9 out of 10, 90% are imported. This is our major way for prevention of HIV. But we only manage to produce on our continent 10% of the condoms we need. And it doesn't even change our appetite. Anyway, my point is this, that unless we move towards manufacturing and being able to solve some of these issues for ourselves, this dependence on importing masks, importing gloves, importing everything, it's just unsustainable. We can't save lives like that. So I think for us, Africa, finding ourselves waiting to buy a test kit as our people die should teach us that let's move this integration agenda faster so that in some areas we are self-sufficient. Our lives are too important to put. I could give you the data for ARVs. People are making money off our illness. 25 years on, people are making money selling us every little pill we need to keep alive. It's not tolerable. So to me, that's one of our lessons, to move the integration agenda and start producing, because we can't compete with India unless we integrate our market. We can't do local production without integration. So the lesson is move integration faster, more ambitiously, and there will be some entrepreneurs. I don't care even if it is a Muzungu, but who will bring a plant and start manufacturing in Africa. Those for me are some of the lessons.
You've spoken quite a lot about international cooperation, global governance. If you take what we have today, what do you think needs to change for us to have a kind of a global regime that actually works for this age?
I'm so glad you've asked that question, Charles, because right now we are in total paralysis. There is a real war going on, a cold war, if I may call it that, for lack of a better word, between China and the United States. And with the Europeans standing somewhere there, not neutral, but also trying to fight their own corner. And in this context, global decision-making is nearly impossible. So, like now, you saw how the United States is pulling out of WHO at a time when we need leadership and cohesion and driving together to fight a global disease. They are walking out. We are trying, the Europeans come forward and say, let's try to pull some money together and knowledge to move fast to a vaccine. But even as we organize around them and we say, okay, let it be a people's vaccine, secretly they cut deals with their companies to make the first doses for themselves, because nobody has faith that the global system can work for them. So the reform of the global system and the restoration of multilateralism is critical, really critical. If we have to keep looking for solutions outside, then those solutions are for me first, and it is those with the strongest elbows who take. And we are all not safe. So I am concerned about this division between, my view is that China, and not only China, and other emerging powers who were not powerful at the time of the Second World War need to be given their recognition and equality in a global system that's reformed. Short of that, they will be outside breaking the rules because they don't believe the system is fair. So there is an urgent need for the reform of the global system. There is also, of course, the need for ourselves as Africa to pull together and be a voice within that system.
Alex, you have, I think you have another question.
Yes.
Juki will take that.
Right. So there's a question here from Hesbon Owila. He says he likes the idea of strengthening our health systems, given that these short-term stimulus packages are not sustainable. However, a few critics have talked about the construction of specialized infectious disease centers dedicated to specifically handle COVID-19 and other highly infectious diseases. So they think that this would free our hospitals to attend to other ailments. But so what is your take on this, Winnie?
There are like two issues there. One is about strengthening health systems versus having vertical systems to address specific diseases. I don't think this is a debate about either or. You need to tackle all. But you need to start with a strong health system, because even if you have a special approach like we have for HIV, you cannot build a solution for HIV that isn't built around a strong health system. But like I said, with epidemics, what we have learned is that you need three things. You need the science. That's a pillar. You need to move the science very fast to find a vaccine, a cure, whatever. Like in the case of HIV, we are 25 years on since UNAIDS was founded. We still don't even have a vaccine or a cure. But you need to move the science to find treatments and all that. You need the politics. The politics are critical because many times rights issues like in our case, it was about sexuality and sex and taboo issues. You need to get political leadership to force discussions and address sensitive issues. And lastly, you need communities. Communities are everything in fighting epidemics. So sometimes to pull those three together, you may need a special initiative, but it can't be built outside a health system. You must have a strong health system, even though you may have a special program to drive three things together to find a solution. So that's what I would say about this debate on system strengthening or vertical diseases. I don't think it's either or. I think you also said something about, no, I've forgotten. Senior moment.
Okay, so you talked about politics being very critical in response to handling emergencies. We have a question here from Michael Karinga, who says that COVID-19 has uncovered glaring gaps, particularly in leadership and in our politics. Kindly share your vision of the African leader, the ideal African leader for the future, who will be able to handle such a crisis like the COVID-19?
Well, first of all, they must be able to log on. I'm being facetious, but I'm being very serious. We need leaders who actually can connect with the rest of the world while understanding their own context. And that does indeed need having the tools of technology, because today we are so interconnected, and unless you can actually see how the world is changing by using the tools of technology, you're always several steps behind. I'm afraid we have an entire African leadership that should be now in their homes looking after their grandchildren, but not in countries, because they don't have these tools. They are unable to follow, to know how things are changing and how things are connected, because somebody has to interpret for them. They cannot use the tools themselves. So this is a serious point about being technologically savvy, to be able to navigate and work with other leaders to move an agenda. That for me touches on the age thing. that we need a leadership that is younger, because a younger leadership is working with modern technological tools to find solutions. It's moving at a different pace. So that, to me, means that a younger leader who's technologically savvy, but most importantly, who values human rights and promotes human rights. We do have leaders who still think that you can choose human rights versus you can, maybe let me say, universality and indivisibility of rights. There are some leaders who think you can suspend the voice and give the food. I don't agree with that. It is about the whole human being. Even the food, you are not the one giving the food. You are enabling someone to find their food. How do you enable them when you don't let them have a voice? A voice is important for people to struggle and solve their own problems. So we do need a recognition, an understanding of the universality, the indivisibility of human rights, and how human rights are what drive development. A denial of rights cannot lead you to development outcomes ultimately. To me, we need leaders there, and also leaders who believe in equality and practice it. I'm really, really shocked that today still we have a leadership in Africa, not even one woman president. What is that? We are half the world. Are we so incompetent? It is because we have been unable to promote equality right from the beginning. Because you don't suddenly have women presidents unless from the beginning girl children are empowered, have got opportunity like boys, and therefore many girls are out there seizing opportunity, and the media and everybody is recognizing their equality. So we need to see more leaders who stand for equality of men and women and will harness the potential of everyone. To me, those are things that are very important in the leaders of tomorrow, of today and tomorrow. And I have to say, we are far from there.
Right. So I'll just, I'll just ask the last question before we ask Obo to give some closing remarks. Winnie, you talked about this not being just a health crisis, but also a rights crisis. And now let's talk about the right to food. So COVID-19 has definitely disrupted the agricultural sector, broken the supply chain, and the upsurge of the desert locusts. So we have two listeners here, Justice Tarao and Grace Ongile, asking about food security. How can we ensure, as African governments, how can African governments ensure food security, prioritize it in the budget allocation in view of the inequalities that you're talking about?
It beats me that we have, there was a time, I think like 2 years ago, 3 years ago, there were 4 famines in the world. 3 of them were in Africa. The 4th one was in Yemen because they are at war and all that, and they had also cholera. But 3 famines in Africa. Northeast Nigeria, South Sudan, and Somalia were experiencing famine, and there were many other countries also on the verge of famine, but not declared famine. I think a famous person said, it was this Indian Nobel Prize winner, that it is not food scarcity. He pointed us to the systems and the politics that were causing food insecurity. So I think that what is lacking is the priority, as Grace Ongile has said, it is the priority on food production and food self-sustainability that is lacking. our countries invest so little in building the whole supply chain. That means the growing the foods, and then the transportation, the logistics, the marketing, the exportation, the whole supply chain. Our effort, I think, is, how can I put it, for countries that boast independence 60 years on, I think this is one of our biggest shames, that we have failed to feed our own people, that many of our countries are food importers. To me, what it will take is, one, to empower the smallholder farmer. It is the smallholder farm. Our agriculture is smallholder farming, but we've wasted money in so many experiments of commercializing and large scale and agribusiness. If that money was put into the empowerment of smallholder farmers, would be there. We've put more money in infrastructure, but I tend to see that the infrastructure we've spent on is highways, big infrastructure, but I think there's a gap of the other infrastructure that you need to push food production to the processing level, to the preservation level, to marketing in the region. This is another infrastructure that we could put more in, small irrigation and all that. The smallholder, the rights of the smallholder, if we could make it rights-based, smallholder-based, serious investment, plus the logistics for that, I think we'll be able to feed ourselves. That is my layperson's opinion on agriculture and how to make it work.
Charles?
It's always wonderful, Winnie, to have you, and I think UNAIDS is lucky to have you, because I think what we were expecting and what we got was this, to be able to lead us to show the connectedness, that this is not a health issue, and that you've really helped us see that what COVID has done, it has actually shown us that we are actually at a time where the collective interventions of our societies in the economy, the way rights and politics is organized, the way opportunities for education and for democratic participation are allocated and made available, that ultimately these are the things which are safe. And it's really just been wonderful to get that multi-sectoral big picture approach that just takes away from the silo of this is what the doctors need to do and this is what the politicians need to do. And we're really grateful that you've given us. We didn't talk about some of the subversive things. What is the implication of this for politics in the future? If they don't organize themselves, will really rebel and overthrow the strong men and dictators, but that is for next time. I'll pass it over to Alex, to say the closing mark and make a vote.
Last word on you, Charles.
Yes?
Charles here founded an independent newspaper in Uganda when I was a politician there. He and I found ourselves in courtrooms all the time. Then we left quietly.
Okay, so Winnie, thank you so much for honoring our invitation to speak with us today on this very important and most engaging conversation globally. I think in my lifetime, I've never seen anything galvanize global public attention more than COVID-19. We've seen other pandemics like HIV and AIDS, but this has been the most gripping of the ones that have occurred in my lifetime. You have spoken through very complex issues and injected the humor that only Ugandans can exhibit. You know, Kenyans are pretty dry most of the time. We are very formulaic. we have a strange sense of restraint, but we loved your sense of humor. You brought the points home in ways that every listener would understand and relate to. And Charles, thank you so much for the moderation. It's been a wonderful afternoon. So thank you so much. Enjoy the rest of your day.